This is Dr. Melissa. We have this cool SDF video here. SDF is Silver Diamine Fluoride. This is one of our docs, Dr. Lena. She's going to apply it on this patient. You see them right now showing him the Vaseline that we're going to use. SDF does stain when it gets on skin. There is silver in it, and so it kind of does like what I describe as like a type of henna tattoo. If it gets on your skin, it gets a little bit like a dark brown color. It does wash away, and you can wipe it off with like a salt scrub or these special wipes for metals, but just to avoid that, we put a lot of Vaseline just all over, just making sure that we don't get any on the cheeks. And so here you see Dr. Lena, she's really making sure he doesn't get any even on his chin. And there's our little patient, just comfortable, lips feel nice and relaxed. And what we use SDF for is to help stop the cavity process from happening. And the way she's going to do it today is by using a piece of floss. So she's actually doing it in between two teeth. So we're going to use a fuzzy floss that she'll show in just a second. And here we show that she is prepping everything so we don't get any of the SDF on his cheek. And we give him a little tooth chair to help keep his mouth comfortable. So there she is. She's threading the floss in between his teeth. And this is a super fuzzy floss. So as soon as it goes in between the mouth, it expands. Kind of like the foam on like a pool noodle. And here she is. She's going to place the SDF on the fuzzy floss, and it will sit in between the teeth. Now, we want it to sit for a minute. And the reason that we're doing this is that the silver molecules will lyse the membranes of the bacteria that create cavities. So the way a cavity forms is the bacteria eat the food that's left on the teeth, and they produce an acid. Sometimes I joke that they're doing potty on the teeth. That's their byproduct, the acid. And the acid pulls minerals out of the enamel. And as that process continues, especially in acidic environments, that's when we start to get what's called a cavity. So when we took some x-rays, we noticed that he had a very small little cavity starting. And so we're going to place this so that the silver can kill the bacteria in the area. And then the fluoride that's in it will go in, will get soaked into the enamel and can remineralize the enamel. Now that sounds like a miracle drug, which is amazing, but as I described with the staining on the cheek, it will stain part of the tooth a dark color, like a black color. And so we always prep parents for that. And most parents don't have a problem with that happening in between baby teeth that are going to fall out eventually anyway, especially when they're on the back. We have used this on the front too, especially for younger kids if we need a little bit more time before they're able to sit, or if for whatever reasons they can't get any fillings done. Now here you see they went ahead and they put some fluoride varnish after they took off the little floss, and now they're taking, this is our cheek sticker, we call it. They're taking off the cotton because it makes the mouth really dried out when you got it open, and that's just cotton right there. So they're pulling that out. They're going to clean him up, and then he's all done. He can go home and he can eat and drink whenever he wants. Now, I know Dr. Lena likes kids not to eat or drink anything for 30 minutes just to let that soak in there. Any questions about SDF? Give us a call.